Good afternoon, everyone. My name is Jennifer Kahn Marshall, and I am a Senior Program Analyst at the National Association of County and City Health Officials, and I manage our Big Cities Chronic Disease Community of Practice and our Tobacco Prevention and Control programs.
And good afternoon. My name is Diana Kosmasic, and I'm the Senior Analyst at the Association of State and Territorial Health Officials, and I also focus on tobacco and chronic disease prevention. We would like to welcome you to today's interactive webinar, Leveraging the CDC TIPS campaign to support the recommendations of the 50th Anniversary Surgeon General's Report, Experiences from the State and Local Level. This webinar is the second of a series of webinars that ASTHO and NACCHO will be offering this year on current and emerging topics related to tobacco control. Despite significant progress since the first Surgeon General's report on smoking and health was released 50 years ago, smoking remains the single largest cause of preventable disease and death in the United States. Released in January 2014, The Health Consequences of Smoking, 50 Years of Progress, outlines key evidence-based strategies, such as sustained, hard-hitting media campaigns that can be used to end the epidemic of smoking-related death and disease. The Tips from Former Smokers campaign offers one such example of a campaign that can be used to support state and local health department sustained media efforts around tobacco prevention and control. In this webinar, we are delighted to have experts from the state of South Carolina and the McLean County Health Department located in Illinois speak about their efforts around sustained media efforts by leveraging the Tips from Former Smokers campaign to meet the recommendations of the 50th Anniversary Surgeon General's Report. NACCHO and ASTHO will provide a brief overview of resources available to assist state and local health departments with end-game strategies. We will introduce each of our speakers before they present on the call today. All phone lines for participants have been muted during this webinar. If you have a question for one of our speakers, please post it to the chat box on your screen at any time during the webinar. These questions will be used during the Q&A after today's presentations. At the conclusion of the webinar, you will be directed to an evaluation survey. Please take a few minutes to provide us with feedback on today's webinar. We look forward to hearing your comments. Also, a recording of this webinar will be posted to the ASTHO and NACCHO website in the next few days. These sites are available on the last slide.
We are joined today by an esteemed panel of experts who will be telling you individually more about their specific role in tobacco control. Before each speaker, we will be providing a brief introduction. We anticipate that there will be many questions for our speakers, so we have made an effort to allot time for that at the conclusion of the panel presentation, particularly because we have over 123 people who have registered for the webinar today. We are joined today by Rear Admiral Boris D. Lushniak, who is the acting United States Surgeon General. Dr. Lushniak articulates the best available scientific information to the public regarding ways to improve personal health and the health of the nation. He also oversees the operations of the U.S. Public Health Service Commission Corps, comprised of approximately 6,700 uniformed health officers who serve in locations around the world to promote, protect, and advance the health and safety of our nation. Dr. Lushniak served as Deputy Surgeon General from November 2010 until July 17, 2013, when he assumed the duties of Acting Surgeon General. Dr. Lushniak was born in Chicago to post-World War II immigrants from Ukraine. He was admitted to the 6-year honors program in medical education at Northwestern University and completed his Bachelor of Science degree in Medical Sciences in 1981 and obtained his medical degree in 1983. In 1984, he completed the Master's of Public Health degree at Harvard University. He completed a residency in family medicine in 1987 at St. Joseph Hospital in Chicago and a residency in dermatology at the University of Cincinnati in 1993. Dr. Lushniak maintains board certifications in dermatology and preventive medicine. He served as a staff physician in dermatology at the National Naval Medical Center in Bethesda and is an adjunct professor of dermatology at the Uniformed Service University of the Health Sciences. A firm believer in leadership by example, Dr. Lushniak also promotes the core messages of the National Prevention Strategy via his active lifestyle. He is an avid long-distance bicyclist, runner, and hiker. In 2012, he scaled the summit of the most heavily glaciated peak in the United States, Washington's 14,000-foot Mount Rainier. We are thrilled to have Dr. Lushniak with us today. Dr. Lushniak, I will turn it over to you.
Yes, thank you so much, and thank you for that kind introduction. I'm really excited being here today, and certainly with the partnerships that we have with ASTHO and NACCHO, the work that we still have to do in the realm of tobacco use in this country, and in our hope to actually create a tobacco-free generation, is really a shared responsibility, a shared mission, but also it's certainly you who work at the state and local levels that are key for us to be able to achieve those goals. What I'd like to do over the next 10 or 15 minutes is actually, before we begin talking about sort of the TIPS campaign and how states and locals can play a role in terms of getting the work done, utilizing campaigns such as that, I'm going to take a little bit backwards in terms of looking at the last 50 years of activity regarding tobacco use in this country and the activism that has not only been coming forth from the Office of the Surgeon General, but in fact national activism as well. At the same time, I'd like to re-emphasize, so that we're all caught up to speed, of what came out recently in January of 2014 in the 50th anniversary Surgeon General's report on smoking and health. So if we look at, the activism, and we all know that we're this year in an anniversary year. This is 50 years of incredible work that's been conducted. And this all stemmed to some extent from the first Surgeon General's report on smoking and health, and this came out in January of 1964. The then Surgeon General, the 9th Surgeon General of the United States, Luther Terry, after about a year and a half work with a steering committee, with a committee that was looking at the scientific information regarding smoking health, came up with a rather simple conclusion, and yet a conclusion that had incredible ramifications. And the conclusion, I'll paraphrase here, in essence stated what? Stated that after they looked at all this literature, after they looked at all this scientific information, and in the era of 1964, this is still the Kennedy, post-Kennedy era of our U.S. history, was a determination was made. And the determination was that, and this is paraphrasing, sort of quote of sorts, is that the health consequences associated with cigarette smoking in this country are of substantial impact, that they merit or warrant appropriate remedial action. And notice that simple word, appropriate remedial action, resulted in a 50-year endeavor, which we still continue to this day, of taking action against what we know is an incredible impact on our public's health. In those 50 years, since that first Surgeon General's report in 1964, the Office of the Surgeon General has issued 32 Surgeon General reports on smoking and health. And over these years, sometimes they were compendiums of a look backward, sometimes they were compendiums of the science of the moment. And as shown on this slide, you can see that in that time period, we looked at not only smoking, but also secondhand smoke. We looked at heart disease, COPD, cancers, pregnancy complications, as well as pediatric diseases. So a lot of progress had been made in those 50 years in terms of official reports coming out. And if you look at the timeline of activism, right, from a simple word saying appropriate remedial action in 1964 to ultimately the banning of advertisements, ultimately to the banning of smoking on airplanes, the banning of smoking in many public places around the country and restaurants, all this stems from that initial wording of appropriate remedial action. So 50 years later, we get to the ability for us to not only look backwards, and I do want to portray to you that on January 11th, the very day that Surgeon General Luther Terry put out the report 50 years ago, a small group of Commission Corps officers, a small group of tobacco activists gathered at Arlington National Cemetery in almost a ethereal atmosphere. Light rain falling, a cold January day, and we're there to lay a wreath at the graveside of Surgeon General Luther Terry to commemorate all the activities that occurred not just under his leadership 50 years ago, but in essence to 50 years of activism that has led us to where we are now. And I'll explain where we're at now because some of it is good news and some of it is not so good news. So a week later, the 50th anniversary Surgeon General's report came out. And again, as an acting Surgeon General, I was both honored and humbled to be in this place at this time to be the person who was releasing the report. Obviously, many accolades go to all the authors of the report. Many accolades go specifically to the CDC's Office of Smoking and Health that for the last 5 years has played a key role on this. But I'm going to hit you with the 10 major points that came out of this. And those of you who may have seen either were there in person or saw the release, the videotape of the release of the Surgeon General's 50th anniversary report, which occurred at the White House, you will get a review of those 10 important points that came from this 50th anniversary report. First and foremost, as already stated, is that after these 50 years, we still have a problem in this country. And over 20 million, in these 50 years, over 20 million premature deaths have occurred since that first report. And we still have annually nearly 500,000 people dying from smoking-related diseases in the United States. It remains, as stated earlier, the single largest cause of preventable disease and death, and that is the answer. When people ask me, why the Office of the Surgeon General persists at this? Why is it in 50 years you've issued 32 reports? Why don't you just sort of say that, you've kind of pseudo-solved the problem, it's enough. The reality is it boils down to this, nearly 500,000 annual deaths from this. What we know, looking back at these 50 years, is that we made some progress in those 50 years. If we look at the statistics, we look at the epidemiology, we know that as a result of tobacco control measures, 8 million lives were saved since 1964. But 20 million lives, as noted up top on this slide, were lost. At this point in time, we still have 45 million people who smoke. That's around 18% of the U.S. population. That's down from roughly 43% 50 years ago. But more importantly, around 3 million youth are current smokers. The burden on our country is overwhelming, an economic burden of $289 billion, of which direct costs for medical care associated with smoking-related diseases, $130 billion. And from that, roughly 60% are coming from public funds. So this is an incredible impact on our society. Major point number 2 is that we realize that we do have an entity that we are fighting. Let's face it, after 50 years, over the years, sometimes there's been, sort of a back and forth, negotiations. In essence, the tobacco epidemic, at this point in time, and as a result of even rulings by the Department of Justice, it's with, we have an enemy. Let's just call it what it is, right? The tobacco epidemic was initiated and is sustained by an aggressive strategy of the tobacco industry, which deliberately, to this point in time, still misleads the American public. That industry spends nearly $1 million an hour, right? This is 24 hours a day, 7 days a week to market their deadly and addictive products. That's a per capita spending from the industry of roughly $27 per person compared to, and I know we'll have discussions about this later, the per capita spending at the state level, which for tobacco control, which averages less than $1.50 per person. So we're still up against an industry that has a product that they very well know causes disease and causes death, and yet which they continue to market very aggressively, not just within the United States, but certainly internationally. In addition, this industry has engineered the cigarette. Today we know that smokers have a greater risk of developing lung cancer even though they smoke fewer cigarettes. And things such as the filter mechanisms used on cigarettes, in fact, encourage deeper inhalation of tobacco smoke and therefore more issues associated with that. Point number 3 from the 50th anniversary report is that there are many diseases now that we know are clearly associated, caused by tobacco smoke, burnt tobacco use, that nearly affects every single organ system of the body, that damages overall health status, and can harm a growing fetus. Specifically in this 50th anniversary report, we keep thinking, oh, we've seen everything, and in reality, we are documenting new diseases associated with smoking: diabetes, rheumatoid arthritis, colon cancer, rectal cancer, erectile dysfunction, macular degeneration, cleft lip and palate, ADHD, brain development in the fetus. And we know the impact in our society right now regarding health effects. 16 million people suffer from at least one smoking-related chronic disease. Point number 4, the issue of secondhand smoke. That's been documented in previous Surgeon General's report. The first report that came out, I believe, on secondhand smoke was in 1986 under then Surgeon General C. Everett Koop, and it really shook the world, which is until that point in time, it was really limited to ideas of health effects upon the smoker themselves. Exposure to secondhand smoke, we now know, causes cancer and preventable diseases. It can adversely affect the health of infants and children. We know that of the 20 million premature deaths since 1964, about 2.5 million of those deaths were non-smokers. 100,000 babies died prematurely from secondhand smoke due to SIDS, as well as prematurity and other complications. What was found new in this report is that we now have an association from secondhand smoke and stroke. And so that's a new finding that, once again, we add to the list of health effects. Point number 5, smoking in women. There used to be an old ad campaign that came out that said, you've come a long way, baby. And unfortunately, from a public health impact perspective, that is very true, and it's not a good thing. Disease risks from smoking by women have risen sharply over the last 50 years. Now women are as likely to die from smoking as men. Lung cancer risk is now the same as men. More women are dying from COPD than men. And we know that smoking can cause ectopic pregnancy and reduce fertility. So specifically on that part of our population, an incredible impact. Point number 6 from the report, smoking causes inflammation and impairs immune function, reducing the body's ability to fight off infection and disease. This is seen, for example, increased risk of TB disease and death, as well as other immune phenomena. This may be actually one of the reasons why we're seeing, to some extent, whether it's a direct nicotine effect on the pancreas or inflammatory effects or immune effects, maybe part of the association regarding diabetes. Point number 7. Although we've seen a decline significantly since 1964, certainly by percentage of the population, we still have incredible disparities when it comes to tobacco use. This is based on race and ethnicity, educational levels, socioeconomic status, regions of the country. We see blips of increased smoking rates in the Midwest and Southeast, for example, also associated with sexual orientation, mental illness, and as well as substance abuse. And so we know that even within our population that we really have those disparities that shows up in terms of prevalence of smoking rates. Point number 8 is the fact that we know what works, that comprehensive tobacco control programs and policies are effective. And I know we'll have further discussions and questions about these control programs and how they can be more fully implemented at the state and local level. The reality is that, I'm on board with you. What we need to do is we know the tools that are available. We know that they work. We need to use them more effectively and to fund them more aggressively. So full, forceful, and sustained use of these measures. And what are the measures? Well, point number 9 is the burden of death and disease from tobacco use in the United States is overwhelmingly caused by cigarettes. We know that already. And rapid elimination of their use will dramatically reduce this burden. And specifically, we're talking about the burden on the youth of America. Every day, 3,200 under 18 years of age youth smoke their first cigarette. Every day, another 2,100 youth and young adults under the age of 25 become daily smokers. But we also know that when we look at current smokers, 90% of those adults who smoke started before the age of 18, and almost all of them, 98%, started before the age of 26. So we know that there's an age group there that we need to be targeting in order for them not to become lifetime smokers. Besides the number I gave you earlier of the nearly 500,000 people who die every year from smoking-related diseases, here's yet another reason why we cannot tolerate just sort of letting things be at the current levels, right? So if current trends continue right now, 5.6 million kids, that's 1 out of every 13 children now alive, will die prematurely from smoking-related diseases. And as the acting Surgeon General, or just as a public health professional, that's something that is intolerable for us not to begin to get more aggressive and to do something about this. Our goal really is to make the next generation tobacco-free. That being said, the 10th component or the 10th major point of the 50th anniversary report is that these reports are important to us and important for not only serving as points of reference for our own society here in the United States, but in fact examples for the international community. We know that for 50 years, the Surgeon General's reports on smoking and health have provided critical scientific foundation for public health action directed at reducing tobacco use and preventing tobacco-related disease and premature death. This is the slide that I sort of want to talk about in terms of the big picture. I talked about the idea that we know what works, and what we need to do is to make sure that we more fully and aggressively implement the use of these tools. So it's the concept of year-round, hard-hitting media campaigns. I discussed with you already the amount of money the tobacco industry is putting into promoting and marketing that product. We need to get better at our level to be able to hit back harder. The TIPS campaign is an example of that. I know we'll be discussing that further. The recent FDA campaign, The Real Cost of Smoking, which if you've not seen any of the advertisements associated with that, please look it up on the internet. Very effective advertising, basically arranged from funding by the new Center for Tobacco Products at the Food and Drug Administration, and these really are hitting that population group that we want to hit, roughly the 12 to 17-year-olds. Easy to access cessation treatments are an important part of this. We acknowledge that smoking, the cessation of smoking that is breaking the nicotine addiction is very difficult. Oftentimes it will not occur on the first try. We have the call-in lines, 1-800-QUIT-NOW as an example. Many of them are run out of many of your states and local public health agencies. That being said, that it's not as easy as a healthcare provider saying give up smoking, I'll write you a prescription for a nicotine replacement therapy. It really takes further work. This is an addiction, and it takes that additional counseling that comes with that. There are provisions within the Affordable Care Act to cover many of these cessation treatments. 100% indoor smoke-free laws. Right now, oftentimes when I give interviews with the press on this subject matter, and oftentimes the press is calling from major markets, right? They'll call from New York, they'll call from Washington, from Chicago. They're amazed to hear that only half our population in the United States is actually covered by indoor smoke-free laws, right? The assumption is we know our local communities, and I know here in D.C., we don't smoke in restaurants. It's taken as almost a part of our society now, yet only half our population is covered by such smoke-free laws. That's obviously a lot to do with what your activism can do at the state and local level to make those state and local laws much more aggressive. The issue of excise taxes, pricing, limiting access to youth, very important, right? Really simply, we know the price of cigarettes goes up, the use goes down, and so we have to use that as one of the tools. We talked briefly about the idea of tobacco control programs and how they are underfunded, and we need to make sure that we exert we share the necessary information and exert the necessary influences to make sure that such tobacco control programs at the state level are funded at the CDC recommended levels to keep things going and moving in the right direction. And then finally, we do have a new player since 2009 in all of this, right? And this is, it's the component of public health that a lot of times, we have to get used to the concept of regulatory public health playing an important role in all this. In 2009, the Tobacco Control Act was passed by the Congress, signed by the President. It now provides an authority that we've sought for years within the Food and Drug Administration to actually have this regulatory authority over tobacco products. As occurs in the realm of regulatory public health, things oftentimes in the world of legal, in the world of regulatory, move slowly, but I am enthusiastic that they are now party to this and that we will hear much more from FDA in the upcoming time periods. That, is sort of the conclusion of my 10-15 minutes of discussion on this subject matter. Again, the key points I wanted to make was that we've made incredible progress in those 50 years. A lot of that progress is because of the work that you are doing at the state and local levels. It's through groups like NACCHO and ASTHO that are out there supporting this incredible public health mission. I also want to point out that there are multiple resources available to assist you on this. These are additional tools and resources to promote the report and the recommendations. They include approved PowerPoint slides that you are free to use, fact sheets, key messages, public service announcements, social media resources, and one point of entry to get a lot of this information is at the website of www.surgeongeneral.gov. I will be on for the rest of the call. I'm eager to hear the other presenters, to hear what's going on at the state and local level, and I will be on also for the question and answer period. So we'll be more than happy to engage and come up with some ideas to really, for us to achieve, the concept of a tobacco-free generation in a generation is one of the mantras. And in essence, for us as public health people, to actually allow ourselves to get angry. And one of the things we actually resurrected from the era of 25 years ago when C. Everett Koop was Surgeon General is for us to acknowledge regarding tobacco use in this country is to say, enough is enough. We've had it, we got to do something. So thank you so much.
And thank you so much, Dr. Lushniak, for your comments today. We really appreciate you sharing the recommendations and the critical role that state and local health departments can play in implementing the recommendations that are outlined in the 50th Anniversary Surgeon General's report. We would now like to introduce our next speaker. Sharon Biggers is the Director of the South Carolina Department of Health and Environmental Control's Division of Tobacco Prevention and Control, a position she has held since 2003. She received her Bachelor's of Science degree from the University of South Carolina in 1992 in Exercise Science and her Master's in Public Health from the School of Public Health in 1994. She joined the South Carolina Department the same year, working first in the local health department settings in the Sumter and Columbia areas, and then moving into the state-level Division of Tobacco Prevention and Control in 2000 in the capacity of Schools and Youth Coordinator. Ms. Biggers currently manages both the CDC Cooperative Agreement and the state-funded program for comprehensive tobacco control, which was awarded $5 million in recurring funding as part of South Carolina's 50-cent cigarette tax increase. Her state also received 2 awards under the Communities Putting Prevention to Work program for state-coordinated small city and rural efforts under tobacco control, which focus on 2 counties in the PD region, best known for its tradition as the top tobacco-producing area of the state. These programs focus on policy and environmental change in the areas of prevention, cessation, secondhand smoke, and the elimination of tobacco-related disparities in an extremely challenging environment. Please remember that if you have a question for one of our speakers, to please post it to the chat box on your screen at any time during the webinar. Ms. Biggers, I will turn it over to you.
Thank you, Diana, and what a thrill for South Carolina to follow Dr. Lushniak. We appreciate you having us on the webinar today to talk about the recent success South Carolina experienced with its media efforts utilizing hard-hitting ads from the CDC Tips from Former Smokers campaign to support the recommendations of the 50th Anniversary Surgeon General's report. I'm pleased to introduce my colleagues presenting with me today who were critical in the planning, implementation, and evaluation of the New Year's resolution campaign designed to substantially increase utilization of the services of the South Carolina Tobacco Quit Line. Catherine Warner, Outreach Coordinator with the Division of Tobacco Prevention and Control, and Jennifer Reed, Public Health Outreach Director in our agency's Office of the Director of Public Health, will be joining me today. Kathy?
Thank you, Sharon. And thank you again to our hosts at NACCHO and ASTHO for having us again today. And thank you to Dr. Lushniak. It is an honor to be on this presentation with you. So as you heard from Dr. Lushniak, in the 50th anniversary of the Surgeon General's report, there is a recommendation for sustained population-based mass media campaigns because of their effect on smoking attitudes and beliefs. We knew that if we implemented a mass media cessation campaign that not only would it increase the number of calls to our state's tobacco quit line, it would in turn have that ripple effect of increasing quit attempts among tobacco users and increasing our quit rate, which in turn would positively impact healthcare costs and reduce mortality associated with tobacco use. Now, I know that every state practically on this call has a tobacco quit line, but we thought it could be useful to give you this quick infographic showing the basics of how South Carolina's quit line is structured. And I'll just let you look at that, but of course it's free, and all callers are eligible for at least one session with a quit coach and referrals to local resources. Our pregnant tobacco users can receive up to 10 sessions, and our uninsured callers can get up to 5 sessions. We also offer free nicotine replacement therapy in gum, patch, lozenges, or combination therapy for our uninsured tobacco users.
We knew from our ongoing communications with the Office on Smoking and Health that the next phase of the TIPS campaign was planned for shortly after the new year. Past experience with the quit line had demonstrated to us that January was typically a high-volume month, and that we wanted to capitalize on this increased level of readiness to quit, so we planned for our campaign to dovetail with the TIPS 2014 launch. We employed a multimedia approach in hopes of reaching a broad audience of tobacco users. And because we know that pharmacotherapy used in combination with counseling can double the chance of a successful quit, we also focused a portion of our ad messaging on increasing access to free NRT for our state's tobacco users who are uninsured and wouldn't otherwise have access to these medications.
In terms of how we did this, we started out by developing a budget of about $1.5 million for the New Year's resolution campaign, and we planned out 2 one-month-long flights of advertising buys that began. First flight began on December 16, 2013, and the second flight ended on February 22, 2014. In planning our budget, we wanted to make sure that we coordinated with our quit line provider to ensure that we had set aside enough funding in our contract with them to cover the increased quit coach staffing to deal with the anticipated increased call volume during the campaign. And we also made sure we had adequate funding to provide free nicotine replacement therapy to every qualified uninsured caller who contacted us during the campaign. One of the main things that we were asked by our leadership director, Catherine Templeton, and my boss, Director of Public Health, Jamie Schuster, to do was make sure that we chose evidence-based, proven TV and radio spots. And by far and away, the gold standard was the CDC TIPS campaign ads. So we worked with CDC and MCRC to secure the rights to use several CDC TIPS ads during the campaign. Another thing that we did that was very effective is that we wanted to make sure that we had targeted, cost-effective TV and radio buys. So we utilized in-house software that allows us to overlay Nielsen market research data with our state chronic disease epidemiological data. And this lets us better understand who our target audiences are, where they lived, what they like to watch and listen to, and the times that they like to watch TV and listen to the radio. And based on this research, we identified several key characteristics of the average South Carolina smoker that guided us when placing our advertising buys for both flights 1 and 2. The analysis that we conducted indicated that our audience was skewed towards white males, people without health insurance of all races and genders, and folks who had a high school education or less and a household income of less than $35,000 per year. We learned that they mainly listened to the radio while they were at work during the day, and that they preferred adult contemporary, oldies, sports, Fox News, and religious radio stations. In terms of their TV viewing habits, our research found that most of them were likely to watch between 8 p.m. and 11 p.m. during weekdays and between 7 p.m. and 10 p.m. on Sundays, and that they were very heavy cable TV users. Some of their favorite cable channels included History Channel, Weather Channel, Discovery, Fox News, ESPN, and pretty much any programming that had football on it. We shared this information with our ad reps to help us make strategic ad buys and make sure that the TIPS campaign ads were placed on channels and programming that our research indicated was most heavily watched by smokers in our state. For Flight 1, we spent roughly $150,000 on radio spots with a heavy focus on buying in rural areas that are harder to reach through cable network buys. And we utilized CDC's 30-second cessation tips and Roosevelt tips radio spots, and we just added a state-specific tag at the end, encouraging listeners to call the quit line and letting them know that we had free NRT for uninsured folks. The bulk of our money, though about $500,000 for the first flight of ads, was spent on primetime cable buys on the state's 4 largest cable providers in order to ensure we covered all our high tobacco use counties across the state. And we delayed airing our first TV spots until the week before New Year's Eve to avoid competing with expensive ad buys with retailers during the holiday season. For the TV tips ads, we used Tiffany's tips and Michael's tips, both 30-second spots, which we ran in a 50-50 rotation until January 20th. And we changed the call to action on the last 3 seconds of the ads to make them state-specific and urged people to call 1-800-QUIT-NOW for free help. And then during this process, we would monitor call volume weekly to analyze the effectiveness of our ad placements. And based on our call volume reports from the first 3 weeks of the campaign, we realized that radio wasn't nearly as effective in driving call volume as our TV spots. So in placing buys for Flight 2, we concentrated the bulk of our resources on expanding our TV buys to include purchasing airtime on our local network affiliates across the state and continuing our cable buys. And we expanded our reach and maximized our budget by mainly buying daytime ad slots on our local affiliates because primetime buys on networks are so expensive. And we continued our ad placements during primetime hours on cable, which is cheaper. We spent roughly $650,000 on Flight 2 buy, in which we switched our CDC tips ads to Anthem and cessation tips, and we ran those in a 50-50 rotation on TV. We also introduced a digital advertising component to this on our local network news websites and mobile sites to broaden our reach. For example, we created web and mobile ads in-house that focused on advertising the free NRT for people who did not have health insurance and to call the quit line. And one of the really cool things that we did, we worked with one of our Myrtle Beach affiliates, which is in the coastal Carolina area, and they created a mobile click-to-call ad so that people, when it pops up on their phone, the ad, if they actually press the phone number, it would call directly to the quit line. Another cool thing that we did was that we used the Anthem and cessation tips ads to run what are called pre-roll commercials on YouTube and several of the local network news sites that we bought ads with. And these tips ads ran before the YouTube video loaded and before a news story started on the websites, which even furthered our reach more. We modified the end of the tag on the Anthem ad to not only encourage people to call 1-800-QUIT-NOW during Flight 2, but also to let them know that we had free NRT available to people without health insurance. And what we found is that this combination of increasing our TV ad presence to include daytime buys on local network affiliates and adding the free NRT tag to the end of the Anthem ad, combined with expanding into digital, seemed to give us kind of the perfect trifecta in terms of really effectively reaching our folks here in South Carolina, as our call volume nearly doubled from our early campaign numbers during the last weeks of January and first week of February. And another thing that we did in Flight 2 is that during the final week of the campaign, we switched out our more upbeat cessation tips ad and replaced it with Terry tips. And this helped complement the new national CDC Terry's ads featuring the Surgeon General's 50th anniversary of the report that had just begun running in South Carolina. As you can see by this chart, our CDC Tips campaign dramatically increased call volume here in South Carolina by more than fivefold, or 650%, during the month of January when just our agency ads were running. We had over 3,762 registered callers, which is pretty significant for such a small state, and we had nearly 4,000 registered callers in February, and during the campaign we averaged over 200 callers a day.
And as you can see, looking at the next couple of graphs, the more proof that we have of the impact of our media campaign. When we looked at our quit line reports to see how callers had heard about the South Carolina Tobacco Quit Line, you can see that in February of last year, when we had no media effort, most callers heard about the quit line from health professionals. And then this past February, it's overwhelmingly that the majority of callers heard about the tobacco quit line from the TV commercials. And then looking at this slide very quickly, you can see that, as Jennifer said, when we advertised the free nicotine replacement therapy to the uninsured, we got an almost 10% increase in calls from the uninsured, and our shipments of nicotine replacement therapy increased substantially. We also received an increase in calls from tobacco users with chronic conditions related to tobacco use.
So what were our lessons learned? South Carolina's experience supports the Surgeon General's conclusion that implementing hard-hitting mass media campaigns are effective. Using the CDC Tips from Former Smokers ads, while hard-hitting, appealed to a diverse audience, resonated in rural areas of our state, and could provide dual messaging to reach South Carolinians with chronic conditions, such as Jennifer mentioned in utilizing the Roosevelt ad in February to bring added attention to Heart Month. The multimedia approach was effective also in reaching a wide audience. That it's important to use data to help ad placement and to continue to evaluate the campaign that is running in the event that adjustments are needed. And that overall, the ability to place our state's ad in coordination with the CDC national buy helped maximize impact by sustaining messaging past the end of our campaign and has continued to maintain increased quitline call volume levels. And we certainly want to offer our special thanks to our agency director, Catherine Templeton, our Director of Public Health, Jamie Schuster, for their support, and our agency's Communication Resources staff and Office of Procurement Services for their exemplary teamwork in helping the Division of Tobacco Prevention and Control successfully increase access to effective quitline services through the implementation of our New Year's resolution media campaign. In conclusion, we welcome today's webinar participants to contact us directly and, of course, follow us on Facebook and Twitter or check us out on YouTube. We thank you again for the opportunity to share with you today.
Thank you so much to our colleagues from South Carolina. It was really nice to hear about all of the great work that you're doing, and we really appreciate you sharing the successes in South Carolina to encourage people to quit smoking. We would now like to introduce our next speaker. Ms. Sarah Phylos graduated from the Community Health Education Program at Illinois State University in 2011. She is now a full-time health education specialist at the McLean County Health Department in Bloomington, Illinois. At the health department, she coordinates the Illinois Tobacco-Free Communities Grant, is a certified smoking cessation counselor, and works on several tobacco-free initiatives in the community. Please remember that if you have a question for one of our speakers, please post it to the chat box on your screen at any time during the webinar, and these questions will be addressed during the Q&A session at the end. Ms. Phylos, I will turn it over to you.
Thank you. Thank you so much for having me today. I have been asked to tell you a little bit about just our county in Illinois and what we're doing here at the county level to support and just bring awareness to the tobacco prevention and, of course, promote the quitline. So I want to just start off by just giving you a little info about McLean County if you're not familiar with it. We are right in the dead center of Illinois. Our population is about 175,000, and we are the largest county by land area in Illinois. Some of the things that we house here, we've got both public and private universities. We have the State Farm headquarters and also Mitsubishi Motorway. So right kind of in the center is Bloomington Normal, which is the more metropolitan area, and then we have several outlying towns which contribute to our rural population that we see. Our demographics listed below, we have a big racial makeup in the county, consists predominantly of what is on the screen, but then also a lot of different ethnicities and cultures that reside here. We see a lot of different people. It's about half and half with males and females. Our age range, mostly in the 18 to 44, about 47%. Under 18, we have about 23%, and over 45 is about 30%. The smoking prevalence that we see, we just got our most recent county health rankings for 2014, and we have about 11% of our population using tobacco, which compared to, we have about an 18% tobacco use rate in Illinois, so we feel pretty good about that. And that number just on the national trend and state trend continues to decline, and we see that too here in McLean County over the years. Our Illinois tobacco quitline call data, just kind of reviewing our by month. If we looked at January of 2013, we had about 100 people that called the quitline from our county, and then we compared that to what we saw in December of 2013, just later in the year, and it was at 280 calls to the quitline. So it more than doubled just in last year alone, and again, that continues throughout Illinois, continues to increase a lot. We looked at too, where people are hearing about the quitline and how they're getting the number and reaching out to us, and majority of people are getting the info from TV, and we contribute most of that to the Tips from Former Smokers CDC commercials that we put out that has the quit line call number at the end and also our information here for the health department and what we can offer. So we're really seeing that the Tips from Former Smokers, specifically the TV ads for us, are really getting a far reach and making a big impact here. Let's see. So just a little bit about our Tobacco Free Communities grant that I coordinate here. It consists of a lot of different things. The first would be our evidence-based school program. So it's a program that we do here called Media Detective. It's a 10-week media literacy program for 4th and 5th graders, and it really focuses on both alcohol and tobacco ads and how to kind of decode media messages. It starts off just with, general, we look at, popsicle ads and sports ads and pick out, different hidden messages and target audiences and things like that. And then we eventually get to tobacco and alcohol and how to, make counter advertisements and just looking at a lot of different health issues and how that message is targeted directly to them. We also have Reality Illinois, which is a youth advocacy work about engaging youth for positive change in the community. So we partner with another not-for-profit agency here that serves and works with youth in our community. We partner with 5 local high schools, and this year we chose to work on a smoke-free parks initiative. So hopefully getting 2 large parks in Bloomington Normal to go smoke-free. So we've been working on that through the school year, doing different activities, and they're really enjoying that. Then, of course, the Smoke-Free Illinois Act, monitoring and enforcement, doing some compliance checks, but for the most part, we have pretty compliant businesses here. If anything, sometimes it's just the repeat offenders that we see, and we deal with those on a case-by-case basis. The Illinois Tobacco Quit Line promotion, we promote that through, of course, the CDC Tips from Former Smokers commercials, radio ads, things like that. And then we also promote the fax referral partnerships with local health agencies in the community, some different hospitals and healthcare clinics serving lower income individuals. And what the fax referral does is really just gives those agencies a really easy way to ensure that their clients are going to be contacted by the quit line and that they'll have good follow-up and that they're getting the help that they need. And then lastly is the Freedom from Smoking courses, which is from the American Lung Association. And we just went through the certification for that. Myself and a coworker did. So we are right now piloting the program. It's a 8-week program. We're piloting it with county employees here. And it's going really well. Next week is their quit week, so we're excited about that. And hopefully by later this year we'll be able to offer that to the community members as well. And it is offered in the community at local hospitals, but it is for a cost, and you go through insurance and all that. So we're hoping to be able to hit a new market and maybe offer it for little to no cost and get some people involved with that. So just looking at some of the beginning of our media efforts, we ran these Tips from Former Smokers campaign, the radio ads and TV. This was really all of last year into this year as well. So the goal of these, really when I was picking these out and choosing what, where they would go on the radio and TV, it was all about just getting a wide variety of audiences and getting the attention of a lot of people. So different ages, different races, singles, families, addressing different health issues. I really just wanted to make it, strike a chord with as many people as possible. And I always, when I think of Tips from Former Smokers, I always think of Terry, and I get it from the students I see and anybody that comes in. I think she's kind of the poster child almost for the Tips from Former Smokers. So I kind of wanted to shy away from that and use some that maybe people hadn't seen before and get the attention again. Because just like anything, you become desensitized to these things when you see them over and over. So for our radio ads, we chose Roosevelt, who was a 51-year-old black male. He was a father, a sports lover, and his health issues surrounded, his heart attack and issues that he had with that. And then Jessica, a Hispanic mother who she herself was never a smoker. She's a single mother, works a couple jobs, and she has a young son with asthma. So I chose those two because it was different ones that I wasn't familiar with, and it touched on a lot of different types of people. I thought that either the person themselves or they might know somebody that has dealt with those issues. And then television commercials. These one in particular, the suffering mother who was in the bottom left corner, that one really struck a chord with me, and that was, again, one I hadn't seen before. And this one, I've actually had people contact me asking if I can take this one off the air because it's a disturbing commercial. If you haven't seen it, I would recommend watching it. It starts off with some heavy breathing by this woman, and it's kind of focused on her, and then it pans out to her young son coming and holding her hand, and it's really sad, and everybody could relate to that and see that hurt in that mother's eyes. So I thought that was a really powerful message. And then Marie, who's on the right, I thought it would be good for maybe an older population. She had many quit attempts, and she suffered from that Bergner's disease, which is always powerful to see, something that you might not think of right away. We always think smoking and lung cancer or oral cancer, but a disease like this, it's scary and it gets your attention. And then a final one that I didn't put a screenshot up here, but I really liked it, was it's just called Cessation Tips, I believe, and it goes through a variety of different people, men and women both, different races, different ages, and what I liked about it the most was that it kind of put a positive twist on these tips from former smokers. It started off with them about why they wanted to quit and that they had tried to quit before, and then by the end of the 30-second commercial, it showed them running and showed them active and kept jumping from person to person and why they were going to quit. So I thought it was a really good one. We showed it right at the beginning of the new year. It had some nice music that went along with it. So again, sometimes these can kind of be gloom and doom, and I thought that one was put a nicer spin on it, which I think they're still on the air now. I just saw one last night. So they're getting some really good airtime, and from our data that we're seeing, they're working. People are calling and hopefully quitting. Some other media efforts that we have done, we promoted Kick Butts Day, which is March 19th. We did that in a couple ways. We have another grant that focuses on many things, one of which is smoke-free multi-unit housing, so kind of goes along with our whole smoke-free initiative. And what we did was we put an ad in our local newspaper, the Panagraph, and that ad is the one that says "Thank you" down there. And it just says, "Thank you for kicking butt," and we want to promote smoke-free multi-unit housing. If you have a property or you live in a property that's smoke-free, call us and we'll recognize you on the county website, on the health department website, and I believe the American Lung Association or Rights for Non-Smokers, I think, has a database too, where you can go and see all of the non-smoking multi-unit housing establishments in your area. So again, just to raise awareness of anything smoke-free and promote Kick Butts Day in our county. And then what we also did was I mentioned the Reality, which is working with the local high school students. Last year they worked on they choose their own tobacco campaign. And last year they worked on one called "If You Really Knew Me," and it kind of went along with what was popular on MTV or VH1 at the time. And they made several posters focusing around different aspects of how tobacco harms them. So they did one with animals, which was the poster that you see on the right. They also did one about the outdoors, sports, and being active, and then careers and how smoking can harm your, likelihood of getting a job and all of that. And then those posters, the poster campaign, was turned into a commercial, a 30-second commercial. And so we decided, we ran that last year as our campaign, and then we decided that we would run it again. It only ran for, I think, 2 weeks last year over their Christmas break when they would be home. So we decided, let's make it coincide with Kick Butts Day. We ran it during their spring break, so again, they'd be able to see it. And the students actually starred in the commercial. We didn't reveal any of their identities or anything, but they were in it, and they really loved seeing it. On their at night when they were watching TV, or we chose channels that they watched the most. So they really enjoyed that. And so that was just another way to raise awareness for Kick Butts Day and the anti-tobacco initiatives that we have. And then lastly, more promotion that we did. We partnered with local grocery stores, the Kroger in Bloomington and Normal, and we put Quitline, I guess you could call these advertisements, on the prescription bags that they give out there at the local pharmacy. So we've been doing this for a while now. It's really, you get a big bang for your buck. I think we get thousands of them for just a couple $100s. So we use our WIC clinic here too. We kind of do a joint ad and get the word out that way about quitting. And then one that we're working on right now is just to utilize some of the new materials that the Illinois Tobacco Quitline has put out. So the ad over on the right, Cancer Doesn't Care, only if you only smoke when you drink, we decided to promote that to the university newspaper and see if we can get the attention of maybe some students or people in the Bloomington Normal area that this might strike a chord with them. So just utilizing some old, some new, some things people haven't seen before, and just kind of flooding our community with messages like that. So lastly, just recommendations. We've kind of mentioned some of these. Tailor things to your community. I know, I think we mentioned the Nielsen data. Someone has mentioned the Nielsen data, which gives you really great demographic info about your community. Tells you some retail databases where things are being sold, where the predominant tobacco use is taking place, and it helps you to prioritize your spending and know where to market these anti-tobacco efforts. Choose new media when it's available. I also think it was mentioned the MCRC, which is the Media Campaign Resource Center through the CDC. They have just so many options for radio, TV, print ads, all these things. Some are free. Some you do pay, a one-time flat fee for. And sometimes you can just go there to get, just ideas for things that you might want to just come up with in-house. And it's really just a great resource that we use here all the time. And like I mentioned, using stuff that hasn't been seen before. I think that's really important to switch it up a little bit. And I know that they did come out with some new stuff for Terry, and that's great to see, but it's also nice to see some new faces and some new issues going on. And then choose media that speaks to you. Again, if you're going through that MCRC, likely if something strikes a chord with you and is powerful and makes you kind of take a step back, it's going to do that for somebody else as well. So that's my rule of thumb when I go through and try to pick things. And the more shock value, the better. I think that's kind of the point of these, and whether they're happy or sad or whatever, it needs to stand out in somebody's day when they see these. So that's just kind of how I pick them. So I'm happy to answer any questions that anybody has about our media campaign or anything else that we're doing for our Tobacco Free Communities grant. And thank you so much for having me today.
Thank you so much, Ms. Philos, for your comments today. We really appreciate hearing about all the great work that you are doing in McLean County to help people quit smoking. So thank you again. Before we move into our Q&A session, we would like to take a moment to share some resources available from ASTHO and NACCHO to help support state and local health departments in their tobacco control work. First, the CDC Office of Smoking and Health has compiled a helpful guide to using the free media materials that accompany the 50th Anniversary Surgeon General's report. It includes infographics, fact sheets, web banners and badges, PowerPoint presentations, and other helpful materials. The guide with links to all these materials will be available on both ASTHO and NACCHO's website, along with the recording and a copy of the slides from this webinar. ASTHO also has several other resources on our website that may be helpful to states. ASTHO recently released 2 tobacco publications. The first is a comprehensive tobacco control guide for state and territorial health officials, and the second is a booklet highlighting recommendations about smoking cessation strategies for women before, during, and after pregnancy. Both publications include examples of the work that several states are currently doing in these areas of tobacco control and prevention. ASTHO has also written comment letters on proposed tobacco control regulations, including issues like menthol, e-cigarettes, and the Trans-Pacific Partnership Trade Agreement. Specific to CDC's Tips from Former Smokers campaign, ASTHO has collected letters that were written by states to local medical societies and chapters of healthcare organizations as part of the Talk with Your Doctor phase of the CDC Tips campaign. All of these sample letters are available on our website for others to access. ASTHO also convenes the Tobacco Issues Forum, which is a work group currently chaired by Dr. Ed Ellinger of Minnesota under the guidance of our Prevention Policy Committee, and is comprised of members and staff from key affiliate and partner organizations. The group serves as an opportunity to share tobacco control activities and resources, identify opportunities to speak in a collective voice, and examine the overall picture of tobacco prevention and control in the states. The web address for ASTHO's tobacco website, where you can access more information about all of these resources, is up on the screen now, and also on the last slide of the presentation, along with my contact information.
NACCHO also has a number of resources that can be used by local health departments to support their tobacco prevention and control efforts. First, I'd like to highlight 2 recent publications from NACCHO's Tobacco Prevention and Control team. The first is a fact sheet highlighting how the existing tobacco prevention and control work done by local health departments can support their efforts toward accreditation. The second is a policy statement supporting comprehensive tobacco prevention and control at the local level, which outlines key recommendations for local tobacco prevention and control programs. NACCHO also has a variety of policy statements related to other tobacco prevention and control issues, such as preemption, e-cigarettes, and smokeless tobacco products, which can also be accessed through our website. NACCHO also maintains a tobacco prevention and control toolkit on our website with access to resources, tools, and materials that may be helpful to local tobacco prevention and control programs. In addition, the Tobacco Prevention and Control webpage features new information, including upcoming webinars, resources such as links to the 50th Anniversary Surgeon General Report materials, and the Tips from Former Smokers campaign materials, funding opportunities, and other materials that may be relevant to local health departments engaged in tobacco prevention and control. Through NACCHO's webpage, you can also find access to a free online training that provides a solid foundation for how local health departments can structure their comprehensive tobacco prevention and control programs. My contact information is provided at the end of this presentation, along with the webpage for NACCHO's Tobacco Prevention and Control project. Please reach out to us if you have any questions, or if we can help in any way with your local tobacco prevention and control efforts. So at this time, we will begin our Q&A session. If you would like to ask a question, please type it into the chat box located on your screen. The first question that we have is for Rear Admiral Lushniak. And one of the things that you spoke about during your presentation was the funding at the state level for tobacco prevention and control programs, in particular the disparities between funding by the tobacco industry and by states in particular for tobacco prevention and control efforts. So the question is, what would you recommend for state health departments, for local health departments, for tobacco prevention and control advocates to do to help change the level of funding that's available?
That's a great question. And I think part of it is, we, and maybe all of us in public health, we go through our sort of ups and downs of being enthusiastic and then somewhat lackadaisical, about the issues in front of us. People always say that in public health we have to be optimists because there's no place for a pessimist in public health and the incredible challenges that are in front of us. That being said, the way I look at this is the 50th anniversary year, right? Anniversary years is an ability for all of us to revitalize on the mission. And that's part of our theme for 2014. Yes, it starts with that wreath-laying ceremony I described on January 11th, but it progresses throughout the year to saying, okay, how can we reorient the mission to accomplish our goals? I think part of the issue is whether we talk with the American public or whether we speak with state legislators or whether we speak with special interest groups, there really was a feeling, I think, nationwide that, the tobacco problem is kind of solved, right? That the tobacco problem, you're down to 18%, that's good enough, right? The fact that, we've made all this headway in 50 years, that's okay. I think the way we need to sort of make sure that all the groups, and you realize tobacco control funding, CDC has its recommendations, and they recently put out, in 2014, best practices for comprehensive tobacco control programs, of which I'm sure many of the listeners are aware of. But if you aren't, look it up, because this is, again, the Centers for Disease Control and Prevention with our full support saying here's what needs to be taken care of at the state level. And I think what we need to do is to really sort of refocus our vision that the problem still exists, right? That we use those statistics that have come from the 50th anniversary report saying, are you willing to take on that burden of those 5.6 million kids who will die prematurely unless we do something about it? Are we willing to accept 500,000 lives a year? And really use this 50th anniversary as a point for us to get reactive in all this.
Great. Thank you so much for that response. So our next question, I think we'll direct toward South Carolina. And we have one specific question that asked, in particular, how many weeks of nicotine replacement therapy did you provide to people who called into the line?
Thank you for the question. We provided a 4-week supply of the NRT for our uninsured tobacco users.
Okay, great. The next question could go to South Carolina or Sarah. So Sarah, we'll start with you. In particular, what resources were the most helpful to you as you implemented the Tips from Former Smokers campaign in your community?
I'd have to say definitely that MRCR, the CDC just website, that huge kind of vault of different media of resources that they have. I see a question here about what was the who was the African American mother and her son, and I was going back to just see. It was one of those days where I was probably in the vault for a couple hours and just was digging, and you can really do that because there is so much in there. And kind of like I mentioned, either you get something from there or it makes you think of something else that you could do just in-house, that you don't have to go through there. It just can spark a lot of ideas. So I'd say that, for me at least, was huge in just generating some thoughts about what could be done.
In South Carolina, what resources were the most helpful to you?
For South Carolina, I would say 2 different things. First, I would concur with the MCRC. They were so helpful in helping us understand the ads, the run schedules, all of the different things. That we were real novice at purchasing ads and utilizing the ads, and they were so completely helpful for us. I would say they are a tremendous asset to CDC and OSH, so we really appreciate their assistance. And second piece would be the Nielsen. I think it really allowed us to make some targeted buys that really helped increase our call volume.
That's great. Thank you. So the next question is for Rear Admiral Lushniak. What resources are available to assist communities with implementing the recommendations of the Surgeon General's report? In particular, we know funding sometimes is limited, so what's available to help state and local health departments with implementing the recommendations?
And again, as I mentioned during my talk, at the surgeongeneral.gov site are at least sort of the informational aspects of things that we'd like to share with ASTHO and NACCHO members out there who are, working in the field. That being said, that's sort of one aspect of the information, that we are making available to you, and the resources that at least you can begin that headway of providing, the further work on tobacco cessation programs locally. In addition, I think, when you look at, for example, from the federal viewpoint, the important role that best practices for comprehensive tobacco control programs plays on it. That document is an important resource. In addition, it's the whole issue of looking at the National Prevention Strategy and the National Prevention Council. For those of you who aren't aware, there was a provision within the Affordable Care Act that set up a National Prevention Council and a Federal Advisory Committee dealing with prevention that is inherent in the Affordable Care Act law. The National Prevention Council currently is made up of 20 different federal agencies. A National Prevention Strategy came out in June 2010, and a implementation plan came out a year later. I'd like you to focus on both the strategy as well as the implementation plan, because inherent in the implementation plan, which are basically federal agencies describing what they're doing both in terms of their own policies as well as within their own workplaces. And one of the imperatives of the implementation plan is to create tobacco-free workplaces in the federal government. So that, I think, is an important resource. The other thing is sort of activism at the local level is the whole tobacco-free campus program that's based out of Health and Human Services. This allows, sort of that interrelationship with college campuses and the youth that are attending those campuses to become activists in that as well. I'd like to go back as well to sort of resources that sometimes are helpful for you to advocate at the local level. And it goes back to the previous question, which is what's doable? How do we convince that more resources be put into tobacco cessation programs? And here's a simple statistic dealing with that, which is, when you look at California and the fact that over the last 20 years, so 20-year span in California, investing $2.4 billion into tobacco control programs over this 20-year span resulted in a savings of $134 billion in healthcare costs. That's a 55-to-1 return on that tobacco cessation investment. It's utilizing statistics like that, real-life data and real-life circumstances that I think are helpful as resources for you to continue your great work.
Thank you so much for that advice. The next, question is more of a comment. We just wanted to make sure that everyone on the phone was aware today that the Health Communications branch staff is available at CDC to provide technical assistance to state and local programs to help them choose ads to achieve whatever goals and objectives you're working toward in terms of any type of media efforts. And also, the Office on Smoking and Health at the Centers for Disease Control and Prevention can assist people looking for ads on the CDC Media Campaign Resource Center. So if there are particular ads that you're looking for, please feel free to reach out to the folks at CDC. And if you can't find contact information, please just contact us at NACCHO or ASTHO, and we'd be happy to put you in touch with them. They're really available to serve as a resource to all of you. So the next question I think that many times when we do webinars related to tobacco prevention and control these days, we tend to have questions that come up related to e-cigarettes. And we do have one question that's come up in particular, and I'll just put it out there to whomever wants to take this one. What type of information is being given to smokers who are requesting information about e-cigarettes as a potential cessation device? So how has this come up, and what type of information is being given out?
Well, this is Boris Lushniak. Let me just start because this is a common question over the last, certainly half year, and certainly with the release of the 50th anniversary report of our stance on this. And I always start out by basically saying that one of the roles of the Surgeon General's office is to do what? Is to take the best science available and either translate it or communicate it with the American public. The issue I have with e-cigarettes is that there are too many unknowns for me to sort of point in that direction of advocating for that product to be used as a cessation tool. For example, it does contain an addictive chemical. We know that nicotine is part of it. There's also other additives and components to the vapor within those product lines. That being said, basic questions. What are the health effects of long-term use are at this point unanswered. Our answer tends to be if one is interested in stopping the addiction to nicotine and is looking into using nicotine replacement therapies, there are currently, such products available that are FDA approved for that very reason, right? And they're approved to be, safe, and they approve that they're efficacious. That is, there's evidence they work. Now, they're not perfect. Everybody acknowledges they're not perfect and have to be done in conjunction with others. But right now, the big fear with e-cigarettes from our perspective is the whole idea of, does it continue the use of tobacco products, i.e. one becomes a part-time user of e-cigarettes, when convenient, i.e. when one is in places where burnt tobacco products are not appropriate, and then goes back to burnt tobacco products later that evening. The other issue as an entry point for burnt tobacco products, for example, by youth, you start off with e-cigarettes, you go into this. It really is. There are many unanswered questions, and right now we're not certainly advocating their use for nicotine replacement.
Thank you so much. Our next question I'll address to South Carolina first, and that's in particular, did you focus test ads for your state, or did you just use what you thought would work well? So some folks are interested in kind of the background on how you chose the ads.
Well, we chose Michael's and Tiffany's tips to start out just after the Christmas holiday, because we thought that those were great ads because they tugged at people's heartstrings to quit using tobacco for their kids. And we thought that was good timing. And what we did was we monitored call volume weekly to see the effect that the ads were having. And during the course of the campaign, we did actually make some adjustments. For example, when we moved over to Flight 2, we felt that we had gotten out of the holiday season and we needed a harder hitting ad. And so the Anthem ad proved to be probably the ad that drove call volume the best. And we realized that cessations tips, the further that we got, which was a very upbeat ad, the further we got away from the new year, the less effective it was in driving call volume. So we switched that out and moved to, was it Terry's Tips? Yes, Terry's Tips, which was another hard-hitting ad. So we didn't focus group per se. We went with what we thought would work well, and then we monitored with our call volume and made adjustments as we needed to.
Great, thank you. And Sarah, I know you talked a little bit about some of the ads that you chose. Was there any additional data that went into choosing of the ads, or was it based on kind of your sense of the community and what you thought might work well?
Really kind of sense of the community. We, along with, picking some of these off of that website, we have a really fantastic communications, public relations person here who is really, has great relationships with the TV networks and radio stations and is very good about placement with ads, whether they be radio or TV or billboards or anything like that. So I kind of leave that in her hands, honestly. But just in terms of the commercials that I chose, I wanted them to hit a little bit of everyone. So, all races, all ages. I really wanted there to be a wide variety and for them to be consistent, some overlapping, some, coming out at all times during the year. So there wasn't, one, age group or race that was, predominantly in these ads. I wanted it to be a little bit of everybody and something everybody could identify with.
Great, thank you. This next question, Sarah, in your presentation you talked a little bit about some of the work that you're doing around smoke-free multi-unit housing. So I'll offer you an opportunity to answer first, and certainly anyone else who wants to chime in. But we've had a question in regards to 100% indoor smoke-free laws, which are certainly a recommendation. What are your suggestions for implementing smoke-free policies in multi-unit housing?
Well, I mean, it's been difficult. There are, a lot of toolkits, and I mean, we're not trying to reinvent the wheel. We're just trying to follow what other successful counties in Illinois and beyond have done. The recommendation from our grant was to start with the Bloomington Housing Authority here in Bloomington, and we really didn't have a ton of luck with them, so we kind of decided to go to Plan B and try to just go online and target the public and private multi-unit housing in the county, and we got some reaction from them that was good. We've also sent out postcards to those same places and given them the opportunity to, just like with the newspaper ad, to have us recognize them, because smoke-free multi-unit housing is kind of on the rise and is a desirable thing. Really pushing the financial side of it, because that seems to really be, of course we're talking about health here, and health should be important, but when you really get down to it, they're interested in turnover costs and insurance costs and all of that. And when you lay out for them how much money they'll save by doing something like this, that is what is a real push for anybody to want to do a smoke-free policy. So, and we really kind of let them tailor it to whatever they want. We don't want to go in there and say, you have to do all of this, everything's going smoke-free January 1st. We don't want to take that approach. We want them to decide what would be best for their units, their complex. Maybe it's floor by floor, maybe there's grandfather clauses, things like that. So just making it so they're really making the decisions, and we're just here to help along the way. That's kind of been the best thing that we've realized so far, is that it's got to be in their hands, and we're just here to help.
And this is Boris Lushniak. I'd sort of like to chime in as well for the listeners of this webcast, that there's also guidance that had been put out, and this is one of our partners on the National Prevention Council that I had mentioned earlier from the Department of Housing and Urban Development. And again, this is guidance that right now we hope to promulgate someday into actually being 100% smoke-free policy within publicly financed housing units. But it's great guidance that's available on their website, and it really is a whole toolkit and package, which is information for the landlord, of why it's a good idea, information for the tenants of why, etc. So I would also point towards Housing and Urban Development as a good partner in prevention here.
Great, thank you. So for our last question before we have to wrap up, and this is for Rear Admiral Lushniak, what is the one message that you would want to deliver to state and local health departments about their role in ending the epidemic of death and disease from tobacco?
Well, again, as I mentioned, I just heard to reiterate the message I gave. This is a big anniversary year, right? 50 years ago, the world was completely different. And if you ever determine that, where things in public health are not achievable, let's compare our lives to what it was 50 years ago, right? We go to meetings, people smoked. Roughly half the population smoked. The other half that really didn't even pay attention to the smokers to a large extent, right? Smoking on airplanes, smoking in restaurants and bars. We really, in a half century of progress. And one of the things, if you really kind of you all, as well as myself, as being a person who's passionate about public health, if you look back at a morbidity and mortality weekly report that came out in 1999 that emphasizes the 10 accomplishments of public health in the 20th century. So this was a look at 100 years back, right? Look at those 10 things, and you kind of see how the world changes from a public health perspective in 100 years. Amongst those 10 things was recognition of tobacco as a health hazard. That occurred in the 20th century, right? In reality, we've done incredible things in 50 years. Social norms within the United States have changed. And my final message is let's continue, or let's get re-angered by this. Let's really take on this sense of enough is enough and rededicate ourselves to really making this big difference. I would love for the 75th anniversary report, and that's a generation away, for us, when we look at statistics, when we look at the demographic information, for us to have a bunch of zeros or near zeros when it comes to smoking prevalence. I strongly believe that is achievable. And certainly 50 years from now, when we have a 100th anniversary report, it'll be filled only with grainy photographs of what once was, right, of a historic look back at this terrible addiction that has afflicted so much harm on our nation. So, let's get revitalized with all this.
Great, thank you so much. We want to thank everyone who was able to join us today for this webinar. As we mentioned earlier, you will be immediately directed to an evaluation at the conclusion of today's webinar. Please take a few minutes to complete our survey, as it really does provide us with useful information for our future projects. ASTHO and NACCHO would like to thank the CDC Office on Smoking and Health for sponsoring this webinar. We'd really also like to thank our speakers, Rear Admiral Lushniak, Sharon Biggers, and the entire South Carolina team, and Ms. Sarah Phylos in McLean County, Illinois. A recording of today's webinar and the corresponding PowerPoint slides will be available on our websites within the next few days at the web address on your screen now. We hope that you will use this webinar as a resource and share the link with others once it is available. If you have any follow-up questions about today's webinar, please contact the team at NACCHO and ASTHO respectively. Thank you, and enjoy the rest of your day.